Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about Hashimoto's thyroiditis. 60% unknowing why your TSH is normal, but you still feel awful. What is Hashimoto's thyroiditis? It's an autoimmune disease. Hashimoto's is not simply a slow thyroid. It's an autoimmune condition where your immune system mistakenly creates antibodies that attack your own thyroid gland. This attack causes inflammation and damage. The number one cause of hypothyroidism. Over time, the damage from this autoimmune attack prevents the thyroid from producing enough hormones. This resulting condition is known as hypothyroidism and underactive thyroid. Hashimoto's is the most common cause in the United States. Who gets it and why? Gender disparity. Hashimoto's is overwhelmingly more common in women, with a female to male ratio of 7 to 10 to 1. This suggests sex hormones play a significant role in the disease. Causes and risk factors. It's a complex mix of factors. Genetics. A family history of thyroid or autoimmune disease is a major risk factor. Triggers. Environmental factors like infection, high stress, or excess iodine can initiate the disease. Other autoimmunity. Having one autoimmune disease like celiac or type 1 diabetes increases your risk for others. Global incidence. It's estimated to affect about 7.5% of the global population. However, 5 to 20% of people may have the thyroid peroxidase antibodies, the marker of the disease, without yet being diagnosed. A silent epidemic. 60% are unaware of their condition. A staggering gap in diagnosis. The American Thyroid Association estimates that 20 million Americans have some form of thyroid disease. Up to 60% of them do not know they have it. That's 12 million people, many of whom are likely living with undiagnosed Hashimoto's, the primary cause. Why is it so often missed? Slow, gradual onset. The disease progresses very slowly over years or even decades. Symptoms creep in so gradually that they are often dismissed as just part of aging or stress. Non-specific symptoms, fatigue, weight gain, and brain fog are incredibly common and can be easily attributed to lifestyle, poor diet, or other health conditions, delaying a correct diagnosis. The normal lab test. In the early subclinical stage, a patient may feel unwell, but their standard TSH, thyroid stimulating hormone test, may still fall within the normal lab range. The two stages of Hashimoto's. Stage 1, silent autoimmunity. This is the early stage. The immune system is actively attacking the thyroid, and thyroid antibodies are present in the blood. However, the thyroid is still compensating, so hormone levels, TSH, often look normal. Symptoms may be mild or non-existent, yet the disease is active. Stage 2, overt hypothyroidism. After years of attack, the thyroid gland is significantly damaged and can no longer produce enough hormone to meet the body's needs. Now, blood tests show a high TSH level as the body shouts at the failing thyroid. This is when most diagnoses are finally made. How is it really diagnosed? A standard TSH test only shows thyroid function, not the cause of the problem. A complete diagnosis requires two key tests. Thyroid hormone panel. This includes TSH and free T4 to see how the thyroid is currently functioning. Thyroid antibody test. This looks for thyroid peroxidase antibodies. Their presence confirms the autoimmune attack and a diagnosis of Hashimoto's, even if the TSH is still normal. When and how to treat. When to treat. Overt hypothyroidism, high TSH. Treatment is standard practice to restore normal hormone levels. Subclinical, normal TSH, high antibodies. This is a clinical debate. Treatment may be started if symptoms are present, TSH is rising, or a woman is trying to conceive. Otherwise, it's often watch and wait. How to treat. Hormone replacement. The standard of care is a daily dose of levothyroxine, T4, a synthetic hormone that replaces what your thyroid can no longer make. Lifestyle management. Many find that addressing diet, stress, and inflammation can help manage the autoimmune component and reduce symptoms severity. Well, thanks for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to my channel.